Hey guys, this is Dr. Tom Hagopian with Peachtree Plastic Surgery here in Atlanta, Georgia, and today I want to talk to you guys about thigh-plasty or thigh lift. Who might be a good candidate for a thigh-plasty? What are some of the advantages and disadvantages? And little pitfalls and things you need to watch out for when you do a thigh-plasty. So let's talk about it. Come join me. So a thigh lift. What is a thigh lift? Well, a thigh lift is when you have extra skin and or fat on the inside of your thighs, and we remove them to give you a slimmer, more slender, more taut upper thigh. The thigh is the area, and this may sound really stupid, but it's worth pointing out, the thigh is the area below the hips and above the knees. And that's really what we're targeting. And it's really a problem area for people who have a little aged and sagged skin, but especially for a group of people we call massive weight loss patients, where they were once very large and now they are very small. Typically that happens through surgery, but there are a number of people who do it through diet and exercise alone or some other regimen, and bless them, they are amazing. They are inspiration to me and to everybody. But what happens is the skin will retract only a certain amount, especially if you're a little older and your skin has lost some of the elastin that's normally within it. And so the skin doesn't really bounce back when the fat goes away. It gets a little crepey, a little bit dimply. And what can happen then is it looks really unsightly. It makes your hips look like they're kind of falling. And we could do something about it. Those are good candidates for a thigh-plasty. So what is a thigh-plasty and how is it performed? Well, again, with body contouring, it's in the umbrella of body contouring procedures. With body contouring procedures, there's two things we're working out to fix. There's excess fat and extra skin. And we treat them differently. For extra fat, we use liposuction. I don't think of liposuction as its own procedure. I think of it as a tool. Similar to you would use a hammer if you need to nail in a nail. You use a scalpel if you need to cut skin. You use a liposuction cannula if you need to remove fat. Same type of thing, not an individual procedure, but a part of everything we do now in plastic surgery. There's so much where we use liposuction and especially fat transfer all over the body. It's a great part of all of our repertoire of things we do. So if you have extra fat, we do a little liposuction. Now, liposuction in the inner thigh is a little tricky because if you over liposuction that area and you don't remove skin, the skin gets even crepier. It really doesn't retract well in that area. It's also very prone to contour irregularities or divots and dents. It is not a good area to do a high volume aggressive liposuction on. You do not get the results that you want, even if you're young with good skin. Doing a thigh lift at the same time as liposuction is great. And what you do is you basically use liposuction, you remove the extra fat, and then you pinch the skin together and you remove it. It leaves you with a kind of a long scar depending on where your extra skin is. Some people just have extra skin at the very top of their inner thighs, and those people are great. You can do a very small incision and leave scars in the upper inner thighs and it looks awesome. For the most part, people have extra skin throughout their whole leg and even up into the anterior thigh, and for them need an extended thigh-plasty incision where it goes down to the mid-thigh or even down to almost the knee. And that's really common because people, especially with massive weight loss patients, there's extra skin everywhere. What procedure and how much skin we resect is really patient dependent, and plastic surgery is so personalized in this respect. And what I mean when I say that is every patient has different goals, preferences, and values for what matters most to them. And it's my job as a plastic surgeon to not impose what I think looks good on people. It's my job is to really listen and find out what people think looks good on them, what their goals and vision are for their body. And it's my job to tell them what's available to them to safely create or achieve their vision, or if their vision is unachievable, if that's my opinion. But that's my job. It's not to evaluate how good something looks or how bad something looks. It's really not about what I think. It's only about what the patients think. So every patient has their own preferences, goals, and values for their thighs and what they want them to look like. There are some people that say, you know what, I want the best contour you can give me. I don't care about scars. Do the best you can for contour and shape. I just want thighs that look really good in yoga pants. Well, then we are going to do most likely we would do a very long incision and remove all of the extra skin from top to bottom. And you will have a very great contoured thigh. It'll just be a long incision. And that's great for some people. Other people don't want incisions at all. They want as little incision as you possibly can give them because they really hate scarring. And that's great too. There are some options. So some things we can do, liposuction, if your problem is mostly fat, we can liposuction it. However, in that area, again, the skin doesn't react quite the same as it does on the belly or other places in the body. So it's not a great area to just do liposuction, but a little bit of liposuction can be okay, especially if you do have younger skin. It will retract a little. You just can't be super aggressive. And these are all the nuances of plastic surgery. Another thing we can do is you can do BodyTite, which is liposuction, but with energy on the end of it. And I talk about that in depth in this video up here about liposuction. But in brief, liposuction is a metal cannula that has suction applied to it, and it goes through the fat and we remove the fat. The skin will contract in response to having the fat removed, similar to the way a balloon contracts when you remove water from it. However, you get about 10 to 15% contraction. But when you add an energy device, particularly BodyTite is the most well-studied, it heats collagen in the skin and in the subcutaneous tissues, and that causes it to contract as a natural product of what collagen does when you heat it. And so you get some additional skin contraction, up to 25% of the skin you can contract, which is a great lot of contraction. In return for that, there's a little added expense, a little added OR time, and there's a risk of burns and a little bit extra pain if you're using a Vaser, according to one study. For people who have poor quality skin or really, really want the best result they can get without leaving large scars, it's a great option for them. What are the things you need to worry about? Well, this particular area of the body, when the inner thighs and you make incisions, especially long ones, they usually have a problem healing. And up to a third of patients will have small minor wound healing issues. It's similar to what happens to breast reduction patients. And you can learn more about that from this video here. So when you have very long scars, they're especially in areas that rub together, they're in areas that you have to walk near, prone to moisture accumulation, and these other various things that can make wound healing a little difficult. And so having incisions that come open a little bit here and there is not particularly uncommon with this surgery. The scars themselves are not visible when somebody is looking straight at you, even if they're looking at your legs and you're standing in front of them. However, they are visible when you have your legs spread apart in any particular way. When you wear a bathing suit, they become pretty visible, and any underwear or any lingerie, and they are, again, pretty visible. So that's something that the patients have to be good with. Unfortunately, we don't have a way to really make these incisions scarless yet. I hope one day we will be able to achieve scarless wound healing, scarless incisional healing. And that may be in the future, but it's probably 10 to 20 years away before we're able to figure that out, if we even do. The major risks of this particular surgery are seroma, which is a fluid collection underneath the skin. We typically will use drains for this procedure. It's one of the few procedures we use drains for. You'll have to wear compressive garments for at least 2 weeks, but most people recommend longer, and I would as well. The risk of a hematoma, which is a collection of blood underneath the skin, is pretty low, but it does end up happening sometimes. Usually requires a return to the OR. The risk of blood clotting is no higher than any other procedure, except it's lower than abdominoplasty, and it depends on individual patient factors like your history and the medications you take. The risk of infection is a little higher than other procedures just because of the location of where we're putting a scar. However, it's usually a superficial infection when it happens, and it's usually easily treated. There are always cases of really awful infections that occur and really bad complications with this procedure, just like there are with any procedure. You will find them online. They are very rare. The thigh-plasty is a great procedure. It's best for massive weight loss patients or people with really bad skin. It's not so good for young people. It leaves a really big scar, and if you're a person that doesn't like big scars, it's not the procedure for you. But for certain people, it's amazing. And it's great to give your body a better contour. Usually we use it in conjunction with other procedures in a massive weight loss patient as part of a package of removing the extra skin from top to bottom or bottom to top or whatever order you decide to do it in. So I hope you guys enjoyed today's video. If you do, please, and you're watching this on YouTube, please hit the like and subscribe button down below. If you are watching this on Instagram, congratulations. Thank you to my family. This is my most important platform. It's where I put all my stuff. It's the one I spend the most time on, and it's awesome. And so I'm trying really hard to get it better, and this is part of the content that I do to do that. So if you're on my Instagram, great. Like this video, comment down below, Tell me how much you like it or don't like it or what I could do better. I will listen to that. If you want to reach out to me, you can send me a DM on Instagram. Again, I am at Dr. Thomas Hagopian. I am also on Reddit. I frequent the r/plastic surgery subreddit and the r/reduction subreddits. I am Dr. Tom PS on Reddit. Great group of individuals. If you're thinking about getting a thighplasty, a thigh lift, or any body contouring surgery, head on over to r/plastic surgery. They will help you out, ask questions. I may even answer them. I'm frequently on there as well. Great group of people. And finally, if you're watching this on YouTube, congratulations, you're one of the few, but welcome to the community. I'm really happy that you guys are here to watch it. YouTube is the platform I started on and then quickly realized that Instagram was where it's at with plastic surgery education, but I haven't given up on YouTube. I love YouTube. I watch it myself all the time. So I will continue to release videos for as long as I can, and hopefully you guys continue to enjoy them. But if you are on YouTube, please hit the like and subscribe button down below, and we'll get you, we'll make sure you see all of everything that we do here. Thanks a lot. Thank you for watching, and I'll see you next week.